Asthma. Asthma is one of the big things that we deal with here, and it's a pleasure to do it because when somebody has asthma, I tell them, oh, it's wonderful, you have asthma. And they go, I'm in the wrong place. But the reason is that asthma is defined as reversible airway disease, either quickly or acutely with bronchodilators like albuterol to help open you up quickly, or long-term because of inflammation that's there to make one feel great all the time and for the rest of their life. So that's why I tell them, you know, if you had to have a respiratory disease and you're having respiratory symptoms or breathing symptoms, asthma is the one thing you really want to have because it's easy to detect and great to treat. So how do you know you have asthma? What might make you think that you have asthma? If you feel short of breath or tight, just standing around, sitting around, that's not normal. You shouldn't sit there and go, oh, you know, I'm just not breathing well. That's a sign that you have airway constriction, you're not getting enough air. Also, when you can't exercise or exert well, what does that mean? Well, you're running or you're active, you're exercising, you have to stop and just recover. Or you have to slow down. That shouldn't be happening. Also, some people even avoid activities and don't do stuff because they know it's going to cause respiratory symptoms. And that's just not allowable. That should never happen. Kids, especially little ones, you know, I'll ask them, oh, gee, you know, do they have any problems running or playing? I go, do they ever stop or slow down? They go, yeah. And I go, well, kids are perpetual motion machines. You know, they actually stop and say, yeah, you know, yeah, because my other kids never did that, or my, you know, my sister's kids, you know, they just run around all the time. That's a sign that you're not getting enough air because your airways are constricted. Asthma. Asthma is also worse at night than it is during the daytime. That's why two classic symptoms are nighttime cough that wakes you up, or breathlessness in the middle of the night, or cough or tightness when you first get up in the morning. And that's because we make a protective chemical all day in our body, and that helps you with asthma. So what you have is this stuff coming out of your adrenal glands called cortisol, which is a steroid. Steroids are the anti-inflammatory medication. So what happens is that it doesn't come out in a straight line all day. It comes out in a big sine wave. So it's highest from noon to 6 p.m. and it's lowest between midnight and 6 a.m. So when do you have your least protection? In the middle of the night or in the morning. That's why night cough, morning cough are classic for asthma. Also wheezing. People go, well, yeah, I wheeze. Oh, but I only do it once in a while. Oh, I only do it when I run. Or I only do it before I go to bed. Or I only wheeze when I get sick. And some will actually go, oh, I only do it once a day. But wheezing, what is that? Is that abnormal? And the answer is yes, because these are breathing tubes. And when you're a certain size tube, air flows in a straight line. But when a tube is constricted, air flows in a roundabout, turbulent fashion. And that's what wheezing is. Turbulent airflow. It's like here in Colorado, when the winds come through at 50, 60 miles an hour, we get these gusts. You hear that little whistling in your roof? That's turbulent airflow. That's what's happening here. Not normal. Also, if I ask, well, if you had a bronchodilator, like albuterol, and some people know what that is because other people in their family have it or their friends have it, I go, if you had this thing that would open you up whenever you have any of these symptoms, how often would you use it? And they go, oh, once in a while, maybe just once a day or twice a day or every other day. But properly used, using a bronchodilator like albuterol, if you need it more than twice a week, you're not in control. You're unstable. That means there's all this underlying inflammation here and you need to take care of it. So what we do is try to figure out, do you have asthma? Good history, good physical, and then certain testing will show that you do or don't have it. You want to treat it because you want to live a normal, perfect life without symptoms and limitations. But there's other considerations here. Is it just feeling like garbage or not being able to do something? And the answer is no, there's more to it. What happens is that you have inflammation in your airway, and if it gets tight enough, if you're insulted enough by a virus, bacteria, strong odor, smoke, perfume, you may get down enough that you may need to be on prednisone or oral steroids. Well, steroids are nasty stuff. They're a necessary evil at times, but if you need them too much, they will do damage. They will do things to your body that really aren't that great. Also, if it gets really tight, well, you need to be in the hospital. You need to be on intravenous steroids. Or you go like this. Asthma can kill you. But we like to think that nobody should ever die from asthma. Either you catch it when it's way down, or more importantly, you're treating back here so that things are always in great shape and that the airways are always open and not inflamed. But there are other things. There's something called remodeling. And what is that? Okay. So if you have an airway that's inflamed, and it's that inflammation that causes the constriction and the cough and the mucus production, this inflammation, well, think about it like this. If you had a burn or a cut and you didn't take care of it, you'd scar. That's what happens in the airways. If you don't take care of that inflammation, you get scarring or thickening of your airway. And that's known as COPD or emphysema. Well, that happens to smokers. Yeah, it does. People smoke or are around secondhand smoke or were in a bad profession, they were around asbestos or beryllium. But it happens to untreated or undiagnosed asthmatics or those guys who don't take their medicine. That remodeling can be reversed. In fact, if you catch it early enough, total reversal of all that inflammation and thickening. But if you've had it a long time, you'll still get rid of most of it and it won't get worse. In our really little guys, well, I should say little, anybody under age 7, there's another important factor. You know that the coconut here, the brain and the skull grow the first 9 years of life. Well, the lungs grow and branch 23 times in the first 7 years of life. But they can either grow or they can deal with inflammation, and they don't do both very well. So what happens? Well, you get not full development of the lungs, and by age 7, the factory shuts off. No more lung growth. So it's important to catch it in kids because if you do, you get rid of the inflammation, they'll have catch-up lung growth, and then they'll have full development of their lungs when they hit age 7. So very important to get on top of this. So asthma, yeah, problematic, but you can do something about it to live a wonderful, fantastic life. And that's what we do here, evaluate and treat asthma. It's very fulfilling because you have people who are not able to do things or have a poor quality of life, and even within one visit, they didn't know that they could live this wonderful, fantastic life. It's a joy. So if you think you have asthma, you should look into it. You should have a specialist that does asthma, such as us, evaluate and treat. So again, don't let it go. Do something about it.